And we believe that our views represent the views of a great number of the American people who have tried to say in every way they know how, through town meetings, through surveys, through elections in Virginia, New Jersey, and Massachusetts, that they oppose the health care bill that passed the Senate. The only thing bipartisan will be the opposition to the bill.
No one is talking about reconciliation.
So, LAMAR, when you mentioned earlier that you said premiums go up, that's just not the case.
The Congressional Budget Office report says that premiums will rise.
Is 1 out of every $3 that gets spent doesn't help anybody get well and doesn't prevent anybody from getting sick. Well, the government now directs over 60% of the health care in this country. And if throwing money at it and creating new government programs could solve it, we wouldn't be sitting here today.
I think that there are things that we could do at the state level to help foster innovation and eliminate some of the concerns that you've got.
A lot of Americans say to me, if you're really interested in controlling costs, well, maybe you shouldn't be spending $1 trillion.
There was an imbalance on the opening statements because I'm the president.
I was glad to hear my friend Tom Colburn's remarks. I think we agree with most of them.
There are some fundamental differences between us here that we cannot paper over. We do not agree about the fundamental question of who should be mostly in charge.
Actually, any insurance that you currently have would be grandfathered in so you could keep.
Well, Mr. President, if I could clarify, that's for a very limited period of time, number one. Secondly, the incentives are set up so that employers would drop you from their coverage because it's cheaper for them to pay the fine than to continue to pay the insurance, so they wouldn't be able to keep what they have. And third, there are still mandates in the legislation as to what you can do with what you have, such that it doesn't end up being the same coverage.
Go through this 2,400-page document, remove all the special deals for the special interests and favored few, and treat all Americans the same.
We're not campaigning anymore. The election's over.
I'm reminded of that every day.
We just can't afford this. I mean, that's the ultimate problem here.
I think the cost issue is legitimate, and whether we can afford it or not, we'll be discussing that.
I even had one constituent, you will not believe this, and I know you won't, but it's true. Her sister died. This poor woman had no dentures. She wore her dead sister's teeth.
Mr. President, you've said healthcare reform is budget reform. You're right. We agree with that. This bill does not control costs. This bill does not reduce deficits. Instead, this bill adds a new healthcare entitlement at a time when we have no idea how to pay for the entitlements we already have. We've been talking about how much we agree on different issues, but there really is a difference between us, and it's basically this. We don't think the government should be in control of all of this. We want people to be in control. We all want to fix this, but we don't think that this is the answer to the solution, and all of the analysis we get proves that point. The American people are engaged, and if you think they want a government takeover of healthcare, I would respectfully submit you're not listening to them.
The high cost of this bill comes from an unconstitutional mandate. It comes from the fact that for the first time in the 225-year history of the country, the federal government's telling you got to buy something.
This bill that we have before us, and there was no reference to that issue in your outline, Mr. President, begins for the first time in 30 years, allows for the taxpayer funding of abortion.
I've been asked to speak about deficit reduction. I will not.